Hi, I'm Dr. Jordan Carqueville. I'm a cosmetic dermatologist and Mohs surgeon. Today, we're going to discuss a case study, an awesome one, of a before and after of a patient who underwent laser resurfacing, non-ablative, and demonstrates the importance of patience and working through those treatments to get those results. So the picture that you're looking at here was taken 1 year apart. And so let's talk about the process and how we got here. I love this patient. I've seen her for a long time for other things. And one day she just decided I'm ready to start doing something for myself. So we talked about different options and different treatment plans. And we ultimately decided that let's start with skin texture. When we improve skin texture, we're talking about improving fine lines and wrinkles and sometimes deeper lines and wrinkles. We're also improving pigment, age spots, and other abnormalities of the skin that happen as we get older. After assessing her skin, we decided that the best treatment plan would be to start with that outer envelope of her skin. And so you can achieve this with many different lasers. And one of the ones that has kind of an easy recovery is going to be a non-ablative resurfacing laser. Basically, this is a laser that's going to provide columns of heat and energy into the skin without ablating the surface of the skin. Since it's non-ablative, it means that that surface of the skin is staying intact. It means that the downtime and recovery is a little bit shorter and it's a little bit more comfortable. So very rarely are we going to see a final outcome like this with just one treatment. So I did a series of 3 here. I usually recommend a series of 3 in a year if the patient has the time and funds for something like that. And I say this because we're always aging and we're aging linearly. And when we kind of introduce things like laser, we're going to soften that linear, aging line and flutter it out a little bit. And so if you can do a laser a year or a series of laser a year, you're always stimulating that collagen so that it's producing at a regular rate. And this is why I love this laser for many people who are looking for ways of approaching anti-aging. So you can see in this photo that she has significantly less lines. That's the number one thing you see. She's sitting in the same chair at the same time of day with the same lighting. And so just 1 year apart. So that collagen has tightened and has reduced a lot of those lines. You can see an improvement of her pigmentation, even the redness is less. So she overall just looks healthier and with better skin texture, and you can just feel her confidence when you see her in person too. To get these kind of results, I did need to use strong settings on the laser. And she tolerated it. We managed pain. We used topical numbing, sometimes injectable numbing. But to achieve these kinds of results, I needed to do a series of 3 and I needed to use strong settings. So if you're struggling with wrinkles, skin texture concerns, pigmentation, I strongly recommend to consult with a skin expert, a dermatologist, someone who's trained, board certified. Because to get these kinds of results, you have to know your devices and you have to go strong and go deep to get that collagen to work for you. If you enjoyed this topic and want to learn more, please feel free to like, subscribe, drop any questions or comments below. Thanks for being here today.